Hello and welcome to the Columbus CEO Healthcare Achievement Awards. Thank you for joining. I'm Ray PAPROCKI, the publisher and general manager of Dispatch magazines, including Columbus CEO. We've been hosting this awards program for 8 years and always look forward to celebrating this group of outstanding leaders. Tonight, however, looks a little different. When we launched the award nominations in October 2019 and printed the finalists and winners in the March issue, which came out in late February, we had no idea how drastically our world would change in just a few short weeks. So the planned live event for that month was postponed. And here we are on Zoom. Because the 2020 Healthcare Achievement Awards make no mention of the coronavirus pandemic, we wanted tonight to do double duty, to both pay tribute to those we identified as honorees, and also to offer tribute to those healthcare heroes who've served Central Ohio on the front lines these past few months. To do this, we asked each of our 2020 Healthcare Achievement Award winners to select a peer who has made a difference with their service this spring. Tonight, we'll celebrate both groups for their significant contributions to our community. Next, I want to recognize the sponsor who has helped make tonight's virtual program possible. We thank Cover My Meds, a first-time sponsor of the Healthcare Achievement Awards. Thank you for your wonderful support and encouragement throughout this process. We'll hear from two Cover My Meds representatives, KATY Edwards and STUART ARAGON, a little later in the program. Now I would like to introduce Katy Smith, the editor of Columbus CEO. Welcome, Katy, and let's begin tonight's program.
Thank you, Ray, and thank you everyone for joining us. Over the past several months, those charged with the region's healthcare have faced challenges unlike any they've faced before. During this crisis, we depend on the caring providers, innovative thinkers, and devoted public health advocates to keep our families safe. Thank you for what you're doing for our community. Before we begin tonight, I'd like to share a few housekeeping items. Last fall, the magazine began the process of seeking nominations for individuals and organizations that excel in the healthcare community for our annual Healthcare Achievement Awards program. Our judges, who are members of the healthcare community themselves, were tasked with reviewing all these nominations. They selected winners and finalists in 6 categories: Volunteer of the Year, Pathway to Population Health, Healthcare Trailblazer, Lifetime Achievement, Executive of the Year, and Practitioner of the Year. Profiles of all the winners and finalists can be found on our website at columbusceo.com. But tonight we get to celebrate their many accomplishments. And as we announce the winners in each category, they'll have the opportunity to introduce us to their pandemic heroes. Ray will present tonight's first category.
Thank you, Katy. Our first category recognizes individuals making a positive impact by devoting personal resources, be they monetary or time, to help local healthcare organizations, patients, and the community. This award is for our Volunteer of the Year. We congratulate RHONDA Wallace. Our Volunteer of the Year has been committed to LIFECARE Alliance, one of the largest Meals on Wheels providers in the country, for more than 2 decades. And in that time, her role has expanded beyond her original weekend route. LIFECARE Alliance says volunteers such as Wallace are instrumental in the fight against senior isolation, a problem that is silently rampant in communities. Wallace first met representatives from LIFECARE Alliance in 1997. And after she retired from a career in food service at Upper Arlington City Schools, she decided to become more involved. She volunteered in the Meals on Wheels office, then in LIFECARE Alliance's wellness department, and then by taking on office work at the cancer clinic. In addition to her volunteer service, she's a consistent donor to the agency. Says LIFECARE Alliance's office manager, Margaret Rembert, RHONDA is always willing to assist and will come to a clinic or wellness center to register clients. She always has a smile and a great attitude. She is a great asset to us. In addition to LIFECARE Alliance, RHONDA volunteers with Holy Family Church Soup Kitchen and Food Pantry and the Mid-Ohio Food Collective. Please join me in congratulating the 2020 Volunteer of the Year, RHONDA Wallace. RHONDA is going to say a few words and then introduce her healthcare hero. RHONDA?
Hello. I would like to thank Rebecca Hurd for nominating me as the Volunteer of the Year. I'd also like to thank the ladies in the Cancer Center, the Wellness Center, and the woman who came 23 years ago to our women's organization and our church to tell me about it. My hero is Lane Wallace, my husband. He has supported me during Meals on Wheels and both of us doing the frozen meals since the epidemic started. He has been my hero for 47 years. Thank you.
What a wonderful tribute. Thank you, Rhonda, and congratulations. Next, we're going to move on to our Pathway to Population Health Award. It recognizes projects such as wellness programs and community partnerships. We have one finalist in this category. Please join me in recognizing Central Ohio Pathways Hub by the Healthcare Collaborative of Greater Columbus. The Hub provides Central Ohio's most vulnerable populations with access to social and health services by linking 10 Central Ohio agencies. Says Carrie Baker, the collaborative president and CEO, the idea of helping a person attain their ultimate optimal health and healthcare goals isn't new. Our multiple high-quality systems are often difficult to navigate for all of us, especially our most at-risk neighbors. Congratulations to Central Ohio Pathways Hub. And now, let's congratulate the recipient of this year's Pathway to Population Health Award, Kathleen HERATH, Associate Vice President of Wellbeing and Safety at Nationwide Insurance. Both in her time as a nurse and in her current role, Kathleen HERATH has helped people get back on track after a disaster. HERATH says her interest in healthcare started when she was hit by a car at just 8 years old. She spent most of 4th grade recovering in a hospital room. That sounds awful. As an adult, she began a career as a pediatric burn nurse at Shriners Hospital for Children. But after 7 years, a latex allergy forced her to move on from the career she loved. She joined Nationwide, where she found her personal ministry, Total Wellbeing for Employees. HERATH says 15 years ago, while other companies were focused on getting employees to drink more water, exercise, and eat healthier, Nationwide wanted to talk about domestic violence, depression, and financial stress. In her words, you have to get the brain right and the body will follow. HERATH has worked to spread the benefits of Nationwide's Second Chance at Work program for people battling addiction to other companies. She's also worked with the Ohio Opioid Education Alliance and its Denial Ohio campaign, which is funded in part by Nationwide. Her efforts have made a significant impact on the lives of employees and their families, says Gail King, Executive Vice President and Chief Administrative Officer at Nationwide. King says, her passion for the associate experience is really what drives her. I think it's a point of pride that we focus not only on their health, that it's a holistic look at them. Many of HERATH's programs have become best practices for other companies in Ohio. Congratulations to the 2020 Pathway to Population Health winner, Kathleen HERATH. Now she'll share a few words and introduce her pandemic hero. Kathleen?
Thank you very much. Rhonda, that was beautiful. I actually got a little teary in your acceptance of your hero. I would like to specifically thank Gail King, Robert Hardenleith, Tricia Adam, Pam Smith, and Jeff Burke, who really spearheaded this nomination. And I accept it on behalf of all of Associate Wellbeing and Safety at Nationwide. They are a group dedicated to improving the lives of our associates and their families. And a special shout out to the Nationwide associates who have truly engaged in the programs and in making changes. My COVID-19 pandemic hero is Justine Mazzaros, and Justine is an occupational manager at Nationwide, and she manages all of our occupational health nurses across the country. Starting back in February, we began tracking all of our associates who were in China and followed them to make sure that they were returned back into the country and that they were safe. We expanded that to other countries. It was surprising how many people were traveling and getting everyone back. That expanded then into tracking everyone who was ill, really leading all of the contact tracing. Justine worked around the clock and worked 7 days a week for 8 straight weeks, trying to make sure that we were keeping track of every single person. And while we didn't actually have that many people who were ill, we had thousands of the worried well, and we wanted to make sure that we took as good a care as possible and made sure that all of their questions were answered, and those people who were ill got into care immediately, and those people who were not did not seek care and deplete an overtaxed healthcare system. And so my shout out is to Justine and the work that she did with our nurses being on the front lines of making sure that our nationwide associates and their families were safe and received the appropriate medical care. Thank you.
Thank you, Kathleen, and congratulations. We appreciate that. Our third category is the Healthcare Trailblazer Award, which recognizes creative approaches to improving medical care practice and delivery. We're giving 2 Trailblazer Awards this year, one to an individual and one to an organization. We have 3 finalists in the category. First is our individual finalist, and that's Evan DUBRO, founder and CEO, Our Family Home. Evan DUBRO founded Our Family Home in 2007, based on a belief that small homes, well-trained staff, and connection-based care could make a difference in dementia care. Because of the challenging environment, Our Family Home closed on March 1st, unfortunately. However, we are honoring DUBRO for his innovative model. The next finalist is an organization, Central Ohio Primary Care. Central Ohio Primary Care was founded in 1996 when 33 physicians joined together to focus more on patient care than administrative duties. Today it has more than 70 practices and 400 plus physicians who serve more than 400,000 patients. Says CEO Dr. Bill Wolf, by remaining uniquely independent, we are able to focus solely on the best course of prevention or treatment for our patients and refer those patients to the highest quality specialist in the region regardless of affiliation. Congratulations to COPC. One other organization finalist for the 2020 Trailblazer Award is Orthopedic One. Each year, physicians at Ohio's largest and busiest private orthopedic group donate more than 2,000 hours to the education and training of future orthopedic surgeons, family medicine physicians, nurse practitioners, and physician assistants. The investment of time is not a corporate mandate, but rather an extension of the practice's mission to keep the patient at the center of all it does. Congratulations to Orthopedic One. And now for our winners. Congratulations to Dr. Rebecca Jackson, Associate Dean of Clinical Research at The Ohio State University College of Medicine and Director of the Ohio State University Center for Clinical and Translational Science. Over 34 years as an endocrinologist at Ohio State University, Dr. Rebecca Jackson's research is focused on conditions that disproportionately affect women. Dr. Jackson's Healthcare Trailblazer Award, however, is for her fight against the opioid crisis. Nearly a year ago, Jackson pulled a team together to apply for research funding from the National Institutes of Health's Help End Addiction Long-Term Initiative. Ohio State was awarded a $65.9 million grant to bridge the gaps in getting treatment to the people who need it most. Researchers will use data to devise a community engagement model and build a communications campaign. This research will produce a prevention and treatment toolkit that can be used by communities across the country. It's expected the lessons learned from the study could help address other substance abuse disorders. Phase 1 of the study, involving roughly half of the communities, started in January. Says Dr. Jackson, we are thinking more broadly about how we take the science we are doing in the lab and using that knowledge to change the way we deliver healthcare for some of the greatest public health challenges that we have. Congratulations to Dr. Rebecca Jackson. Now she'll say a few words and introduce her pandemic hero. Dr. Jackson.
Thank you. I'm truly honored to receive this nomination and award tonight, and really have to acknowledge our team, which goes across 6 academic centers, works together in close alignment with Recovery Ohio, and our 19 highly affected communities across the state who are working together to really come up with new protocols and new paradigms for reducing the opioid epidemic. Unfortunately, there is actually a coalescence of 2 major epidemics, not only the opioid epidemic, but in fact the COVID-19 pandemic. And so tonight, I'm absolutely delighted to present to you my pandemic hero, Dr. Abigail Norris Turner. I've had the privilege of knowing Abby since she first came to Ohio State almost a decade ago. Dr. Turner Norris is an infectious disease epidemiologist and a nationally known translational scientist. She has worked closely with some of the most vulnerable and underserved populations in the United States and across rural and urban communities in Zimbabwe, Malawi, and Madagascar to advance our understanding of behavioral, clinical, and biological factors associated with an increased risk of HIV and sexually transmitted infections. Through her work, she has become a strong champion and, in fact, a change agent for health equity in the US and the world. In February, when the COVID pandemic first rose, Dr. Norris Turner knew that she had to contribute to being part of the answer for addressing this growing health crisis. She subsequently has pivoted her efforts towards COVID-19 to shed light on the epidemiology of this disease at both a societal and at an individual level. Collaborating together with the Ohio Department of Health and others, Dr. Norris Turner has recently led a rapid response study that will give us a broad snapshot of the spread of COVID-19 across Ohio since the start of the pandemic. Because of her efforts and the efforts of the team that worked with her, we will be better informed, and the evidence from this story will actually allow us to make data-driven decisions regarding the most effective and inclusive approaches towards testing and treating to reduce the prevention of the spread and the health consequences of COVID-19 in Ohio. Abby, thank you for all you do.
Thank you, Dr. Jackson and Dr. Turner, for everything that you're doing. All right, and now the Trailblazer Award for an organization goes to OHIOHEALTH. A new program that supports one of Central Ohio's most vulnerable populations has earned OHIOHEALTH this recognition. The health system's partnership with primary care provider ChenMed brings coordinated care to senior patients in some of Central Ohio's neediest areas. Launched in October, 3 medical centers specifically for seniors have opened in Whitehall, Northland, and the West Side. Available to Medicare-eligible patients over the age of 65, the centers are staffed by primary care physicians and offer unlimited visits and walk-ins. Patients have on-site cardiology, pharmacy, imaging, labs, healthy lifestyle classes, and even access to their physician's cell phone number. Most costs of care are covered by Medicare and Medicaid, and the centers can help seniors arrange transportation too. Karen Morrison, president of the Ohio Health Foundation and senior vice president for OHIOHEALTH, says the health system is excited about the model's potential to help our aging Central Ohio population. It will take a few years for the centers to reach capacity, but OHIOHEALTH anticipates 8,000 patients will be served in all, with the potential to open additional sites serving up to 20,000 in the future. By focusing on preventive care, OHIOHEALTH estimates the program will result in 50% fewer hospital admissions compared with a standard primary care practice and 28% lower costs per member. Columbus Public Health Commissioner Dr. Maishika Roberts says the program could be replicated across the country. Says Dr. Roberts, OHIOHEALTH and ChenMed are trailblazing a new approach to healthcare, making it significantly easier for seniors to receive the quality care they need by reducing barriers. Congratulations to OHIOHEALTH. And now Dr. James M. O'Brien, Vice President of Operations for Population Health at OHIOHEALTH, will say a few words and introduce OHIOHEALTH's pandemic heroes.
Great, thank you very much. And thank you to Columbus CEO on behalf of OHIOHEALTH and our 35,000 associates and physicians, as well as ChenMed in recognizing our dedicated senior medical centers. We're very excited to have been able to bring this different delivery system to the seniors of Central Ohio, and also to provide a different way of practicing medicine for many of our providers. During the pandemic, we've actually seen the way that this can actually raise to deliver care for these patients who are most at risk. Being able to deliver in-home care with our primary care doctors providing home visits, delivery of medications, blood pressure cuffs, and even the delivery of emergency food boxes in partnership with Mid-Ohio Food Bank. So we're very thankful for the recognition of this work that's just underway and for the 1,000 members that have signed up for receiving services. We're particularly gratified by the publication of this award, because we hope that this will attract more patients to this care so that they can benefit from it. During the pandemic, Ohio Health freely recognizes the contributions of numerous people who are on the front line, and certainly don't want to leave behind all of the frontline staff that have provided care. For me personally, my pandemic hero is Joe Henman, who is our Director of Infection Prevention at Ohio Health. And when we start talking about the complexity of delivery of services across 47 counties and care services that range from home care all the way up to tertiary care hospitals, being that voice of reason and helping to interpret the changing recommendations has been something that has really provided a calming attitude for all of the folks who are on the front line and have to provide that care. So much so that she's also been a service for some of our other community partners, including when we've had local correctional facilities or skilled nursing facilities reach out to us for help. So we want to recognize all of the frontline associates and caregivers, and then particularly for myself, Joe Henman.
Great. Congratulations, Dr. O'Brien, and thank you to all your pandemic heroes that you've referred to. Now I would like to introduce Stuart Aragon, Case Manager with our sponsor Cover My Meds, to announce our 4th award of the evening, Lifetime Achievement. Stuart?
Thank you, Ray. Hi, everyone. My name is Stuart, and my pronouns are he, his, him. Thank you for having me, and thank you all for allowing me to do something that I haven't been able to do since the pandemic started, which is to actually wear a fancy suit. I'm happy to be here and proud to represent Cover My Meds this evening. For those of you who don't know us, we're a healthcare technology company, and our mission is to help patients get the medications they need to live healthy lives. Cover My Meds recognizes and celebrates the 2020 Healthcare Achievement Award honorees and the healthcare heroes that are on the front lines during the pandemic. Thank you all for everything that you do. Now, to the Lifetime Achievement Award. This award recognizes longtime and retired healthcare professionals who have demonstrated exceptional leadership, knowledge, decision-making skills, and commitment to their organizations, patients, and their profession. We have a Lifetime Achievement finalist. Congratulations to Linda Howell, Neonatal Intensive Care Nurse Manager, Nationwide Children's Hospital, Mount Carmel East. For the past 6 years, Linda Howell has led the Mountain Carmel East NICU, where she provides best-in-class care while sustaining employee engagement. She went back to school while working full-time to earn a master's in nursing in 2016 and is dedicated to supporting her team as they pursue their own educational goals. So congratulations to Linda Howell. Our Lifetime Achievement Award winner has made contributions that are difficult to overstate. He is Dr. Michael Pera, a physician with Equitas Health and the Ohio State University Wexner Medical Center. On a personal note, I must say that Equitas is an amazing organization, and the work that they do every day really touches the lives of the community that it serves. And that's why I'm happy to be an Equitas patient. Now, please allow me to introduce to you Dr. Pera. For nearly 4 decades, Pera, known as Columbus's AIDS doctor, has fought the disease through research, patient care, and education. In the early 80s, little was known about acquiring immunodeficiency syndrome. One giant step was when Pera and others at Ohio State wrangled a $7 million federal grant in 1988 for testing with the antiviral drug AZT. By 1996, AIDS was no longer a death sentence thanks to pharmaceuticals. Today, those infected with HIV can take a single pill a day and live a normal lifespan and not transmit the virus to anyone else. Over the years, Pera has donned many medical hats. He says helping develop AIDS medication is his greatest achievement as a doctor. But it is equally well known for he is equally well known for his compassion at a time when healthcare workers refused to even get near patients. By 1994, Pera had treated more than 600 people with AIDS and seen 400 of them die. There is much stigma to this disease, says Pera, who gave patients his home phone number. Para goes on to say, and I quote, "Not only did we have a disease we're going to die of, you were outed as being gay. What people feared was that they were going to die and no one was going to be there with them because they were gay." In 2012, Para helped Equitas develop a center in the short north where patients could receive healthcare and social services at one site. The organization has 13,000 patients, including 5,000 HIV patients and 17 offices in 11 Ohio cities. Para retired from Equitas and OSU in January, but plans to keep his hands in medicine. Congratulations and thank you to Dr. Michael Para. Please say a few words and share with us your pandemic hero.
Thank you, Stuart. I'm truly honored to be recognized by Columbus CEO Healthcare Achievement Award, the Selection Committee, and Equitas Health for nominating me. The Lifetime Achievement Award is an acknowledgement of past work, but does conjure up a finality of effort, which I'm not quite ready to give up yet, as you pointed out. I plan on continue working more on the education and administrative side of ending the HIV epidemic, which was a national program. Fortunately, there are others, as my pandemic heroine, Christina Lashnevsky, who are carrying out extraordinary fights against the current COVID plague. Christine is a hospital epidemiologist at the James Cancer Hospital. She helped lead the hospital epidemiology team with developing and rapidly reviewing every process in the hospital and outpatient clinic that was impacted by COVID. And pretty much that was everything in the hospital, almost every process, things you would never even think about, such as how do you route ER walk-in patients? Where do visitors go? Are they allowed in? Where is the seating in the cafeteria? And on, like where are we going to do COVID sampling if we can't bring those patients in the hospital for that? Christina had to help organize and oversee work groups, multiple work groups, to address each of these innumerable issues. She had to develop policies and communicate them as fast as possible. Until just recently, she was spending many hours each day in virtual meetings about each of these topics. Christina, one of the things that really caught my attention, she was the one who had to have the sometimes difficult conversations convincing faculty and staff that these complicated processes were absolutely necessary for the protection of patients and themselves in this pandemic that was made all the more worse by this shortage of personal protective equipment. Christina is my heroine for the COVID epidemic. Thank you for this award.
Thank you, Dr. Para, for everything that you've done for this community and all the communities across the world that have been affected by AIDS. And thank you for sharing about your pandemic hero. Well, we've reached the final two award categories of the evening, our Executive of the Year and our Practitioner of the Year. So let's meet the finalists for the Executive of the Year. That is Dan Like, Executive Director for Ambulatory Services at The Ohio State University Wexner Medical Center. Dan Like brings care to where patients need it most, near work or home. He developed a joint venture, Ohio State Home Medical Equipment, that makes sure patients leave the hospital with the equipment they need, such as oxygen, CPAP, walkers, wheelchairs, beds, and more. Congratulations to Dan Like. Our Executive of the Year category recognizes an individual who's had a positive impact through outstanding efforts on the administrative side of healthcare. I'm pleased to announce that this year's winner is Chuck GEHRING of LifeCare Alliance. When GEHRING took over at LifeCare in 2001, it became clear that the venerable Meals on Wheels agency was not in a good place financially. Says GEHRING, we had $250,000 to our name and about a month's worth of working money. It was clear not all of our funding sources were going to continue. We had to do something. GEHRING concluded LifeCare needed to reduce its dependence on government and United Way funding. His plan? Engage more volunteers, increase donations, merge with smaller agencies, and establish some way of making money. It sounds like a lot because the changes Gehring envisioned were a lot, but his staff pulled it off. Today, fewer paid Meals on Wheels drivers are needed because volunteers come from 110 organizations who deliver meals on their lunch hours. Since 2003, LifeCare has merged with Madison County Meals on Wheels, Project Open Hand Columbus, Columbus Cancer Clinic, Impact Safety, Meals on Wheels in Champaign and Logan counties, and in 2017, the Central Ohio Diabetes Association. Gehring also set in motion fundraising efforts that garnered $7.2 million for a warehouse that serves as a meal distribution center, pantry, and dining center. Perhaps Chuck Gehring's most forward-thinking project was figuring out a way for LifeCare Alliance to generate revenue itself. Today, its corporate wellness and catering services carry about 17% of the organization's budget. One achievement he says he's especially proud of is LifeCare's Senior Pet Care program, which began 12 years ago. LifeCare officials saw Meals on Wheels clients were giving part of their meal to their pet because they couldn't get to a store or afford to buy pet food. So Gehring convinced large retailers to donate pet food. LifeCare staff and volunteers deliver it. Says Gehring, to be able to give a person later in life a little happiness and the ability to live in their home where they want to be, I don't know how you put a price on that. Congratulations to Chuck Gehring, our Healthcare Achievement Executive of the Year. Now he'll say a few words and introduce us to his pandemic hero. Chuck?
Thank you, Katie. That was wonderful. I am honored to and humbled, very humbled to receive this in seeing who else, and I congratulate my fellow honorees tonight. They read like a who's who of healthcare in Columbus, and I'm like the weak sister, but I guess I win this too. But I appreciate this greatly. It's really never about me. It's about our crew here. I just talk and stand out front a lot. But we've been very fortunate here to continue to be able to assist all those in need. You know, my hero, I gave a lot of thought to this, and there were a lot of people, including RHONDA Wallace, who won the volunteer award earlier, and who volunteers for us, a number of people. But I think it's really all 250 of our associates. COVID has provided a unique situation for us. Our Meals on Wheels, and if you're not familiar, prior to COVID, we were probably the only group in the top 50 population centers nationally without waiting lists for that program. We continue to take everybody. We are really now the only ones without waiting lists, and we happen to be the largest charitable group as far as number of meals go in the country. Our staff has worked tirelessly through this. We are up 65% in home delivered meals since this began. Our Columbus Cancer Clinic food pantry, which also services Project Open Hand clients, people with active cancer and active AIDS, is up 52%, and we're actually trying to deliver all those goods to them, and we are accomplishing that every day. Our folks have given up their weekends, they've given up their holidays, and they've been on the front lines since this whole thing started, and I cannot thank them enough. And they are the heroes at LifeCare Alliance, not me, and they get it done every day. They go out and see the clients. They've been on the front lines, and knock on wood, we haven't spread COVID throughout our agency yet. So that's a good thing, but it's just an honor to do this. And I've been doing this job now for 19 years, and it's an honor to be part of this organization and be able to serve those in need in Central Ohio. And we will continue to do that. Our wellness centers are back open with our nurses and dietitians, and we will continue to, and you'll see an announcement shortly. We're taking on yet another merger partner agency pretty soon that will expand our services geographically. And we're just trying to help people here. And after 122 years, we're still doing what our founder, Catherine Nelson Black, said in 1898, which is to take care of those nobody else pays any attention to. And we continue to do that. And I appreciate this recognition tonight for our staff.
Congrats, Chuck. And thank you for everything that LifeCare does for our community. Now, to introduce the finalists and winners in our last category, please welcome Kaden Edwards, Network Services Account Coordinator from our sponsor, Cover My Meds.
Thank you, Katie. Just like my colleague Stuart, I'm proud to present this evening on behalf of Cover My Meds. Without further ado, the final award of the night, Practitioner of the Year, recognizes an individual who provides outstanding care and advances the practice of medicine. Our finalist is Martha Simmons from the Columbus Cancer Clinic. For more than 4 years, Simmons has cared for those who have no insurance. By giving them access to cancer screening, Simmons says, quote, "We strive to help eliminate cancer disparities in our community. No one is denied care due to inability to pay." Simmons graduated from college in 1967, but says, quote, "Who wants to retire when I can be part of a compassionate team that has had such a positive impact on the lives of the patients we serve," end quote. Congratulations to Martha Simmons. Now, for our 2 Practitioner of the Year winners. First, congratulations to Mimi Rivard of Equitas Health. On a personal note, as a patient of Mimi's, I can personally attest to the quality of care Mimi provides the trans community in Columbus through Equitas Health. Now, please allow me to introduce you to Mimi. In the 3 years since Mimi Rivard, lead nurse practitioner at Equitas Health, launched the organization's practice for patients identifying as trans or gender nonconforming, Equitas has seen more than 300% growth in the number of trans clients it serves. As we learned earlier, Equitas is a nonprofit regional healthcare system, federally designated community health center, and one of the largest organizations in the country serving the LGBTQ and HIV/AIDS communities. With a background in palliative care and serving the HIV/AIDS community, Rivard developed Equitas Trans Care Program by sitting with members of the community, listening to their needs, and then listening some more. The program now serves more than 1,000 patients. Equitas Chief Operating Officer Peggy Anderson says, Rivard spearheaded the development of new medical services that have been critical to improving health outcomes in the populations Equitas serves. Anderson says, quote, "She met with community members and young leaders in the prevention movement and worked to build connections in key neighborhoods and social circles. She made herself a regular face at community events and showed herself as someone who cared," end quote. Of the trans care patients at Equitas Health, 96% now have healthy blood pressure, 80% of those with diabetes have controlled their blood sugar levels, and those living with HIV, a staggering 87% have achieved viral suppression, which is when one's viral load has reached an undetectable level. The national average for HIV patients who have reached viral suppression is 49%, according to Equitas. Rivard says, quote, "We look at health outcomes for trans people, and there's just really not a lot of data. This is probably the most marginalized population in the United States. Once people are treated with dignity and respect and listened to and seen, they do amazingly well," end quote. Congratulations, Mimi Rivard. Please say a few words and introduce your pandemic hero.
Okay, hi. I would like to thank Columbus CEO for this award, and I'd also like to thank Peggy for nominating me. I am really humbled to receive this. I would also like to thank my family who have generously shared their time with patients. They just make this so easy and make it just a joy to go to work every day. So I'd like to sort of dedicate this to my patients because without them, I don't really think I would be as happy as I am. So I would like to thank them very much. And I would also like to name my pandemic. He was first seen by many of us on television on March 3rd and just kind of burst onto the scene and had this amazing ability to make us all feel better. The first thing I noticed about her as a palliative care provider was I said to myself, wow, this lady can really deliver bad news very well. So since the earliest days of the pandemic, she just provided us reassurance and guidance, and she took complex models and concepts and used elegant analogies to make them easily digestible for all of us at home. My favorite analogy that she used was stars in the sky, and that one just kind of really stuck with me. She delivered all the horrible news every day with empathy and grace. She made it possible for all of us to see ourselves making an impact to flatten the curve. And we did that under her tenure. She achieved great success for us, and she also gave selflessly every day. She made personal sacrifice. The lines between work and home were very blurry for her, as we know, and we're just aware of her ongoing generosity. So she will always shine like those beautiful stars in the sky that she spoke of during a really dark time for Ohio, and that is why I chose her as my hero.
Thank you, Mimi, and congratulations again. Our second Practitioner of the Year winner is Dr. Darrell Gray II of the Ohio State University Wexner Medical Center. For Dr. Gray, being a doctor is about making a difference by listening, promoting diversity, and meeting patients where they need care. Dr. Gray is a gastroenterologist at the Ohio State University Wexner Medical Center who attended medical school at Howard College of Medicine in Washington, D.C. Gray's mission is to advance diversity in medicine. It has the power to save lives because vulnerable populations are at risk due to implicit bias, institutional racism, and lack of opportunities in the field of healthcare. He advocates promoting diversity in medical schools and hospitals across the nation. Gray says, quote, "It's really important that the face of our healthcare looks more like the face of America," end quote. On a national level, Gray is chair of the American College of Gastroenterology's Diversity, Equity, and Inclusion Committee. He's also the medical director for the National African American Male Wellness Initiative. Locally, Gray serves as a medical director for Healthy Community Day, which provides free health screenings to Central Ohioans each summer. And he serves on diversity committees for the Ohio State University Comprehensive Cancer Center and the Ohio State University Wexner Medical Center. In 2014, he created the Provider and Community Engagement Program for Health Equity and Colorectal Cancer Prevention. The program screens uninsured or underinsured patients for colorectal cancer, which is especially important for Black men. Says Gray, quote, "That's what health equity is about ensuring that everyone has a just and fair opportunity to be as healthy as possible," end quote. This month, Gray was lead author on a national paper proposing a framework that academic medical centers can use to combat racism. It focuses on reforms in education and engagement, funding, policies, and practices. Gray says it's his calling to love his neighbor, and the combination of community service and healthcare is just one way he shows that. Quote, "This is where I feel like my talent, my time, and my treasures lie, and I'm giving it all I've got," end quote. Thank you for all you do, Dr. Darrell Gray. Please share a few words and introduce your pandemic hero.
Thank you, Kaden, for that kind introduction. Thank you to Katy and Ray and Columbus CEO, Cover My Meds. This is an amazing occasion. I am extremely honored and humbled to be a part of it, and really to be amongst such esteemed colleagues who've been receiving awards today. Congrats to all of them. For me, it's actually, it's very special as well because I get to celebrate with my family. We are physically distancing together on vacation. And so this is really a great honor for my family and I have the pleasure, I'm blessed to be able to work at The Ohio State University Wexner Medical Center and serve in capacities that allow me to really serve at the intersection of teaching with students and learners and other trainees such as residents and fellows, as well as medical students. I get to do research and partner with community members and organizations in doing such. And obviously I get to work with patients and serving them at the bedside, whether it be in the clinic or in the hospital, even in the endoscopy suite, like Kaden mentioned, doing colonoscopies. And all of that, I believe, is my calling. But, you know, part of it, I couldn't do what I do and love doing it without the people every day that I get to work with and get to meet. And so really, there's so many people I would need to thank. Many of them already know who they are. Certainly, it extends throughout Columbus, Franklin County, the state of Ohio, and beyond. And certainly my family, many of whom are extended along the East Coast, helped to get to this point and really are helping me be a better person for my patients, for my students, for the research that I do. And so I'd like to thank my family, my wife especially, for allowing me to be able to do this in this capacity. As I think about people who have helped me to get here, but also helped me to be effective and help all of us in healthcare to be effective, particularly at the Ohio State University Wexner Medical Center, one hero comes to mind, and certainly there's so many people I need to thank. But I'd like to particularly thank Autumn Glover. So Autumn Glover is no stranger to Columbus CEO. She's a part of this year's class of Future 50, and she works in government affairs, but I work alongside her, not only in her role in community affairs, but also community relations. She also serves as president of our nonprofit affiliate at the Ohio State University Wexner Medical Center called PACT, or Partners Achieving Community Transformation. And really during this pandemic time, we worked together, and really she helped spearhead a lot of this, disseminating masks, or what we called community care kits, throughout Franklin County. We targeted 5 areas, zip codes, really by need. And in those zip codes, throughout 1 week, over a couple of months ago, we gave out 46,000 community care, well, 46,000 masks, but community care kits including toothpaste, toothbrush, masks, hand sanitizer, to people and communities that needed it most. We partnered with organizations such as the African American Male Wellness Initiative. We partnered with Columbus Public Health, ETSS, which is Ethiopian Tewahedo Social Services, the Columbus Police Department, and many other organizations, including Columbus City Schools, to do that. But that's just one of the things that Autumn has been integral in doing. We've also done spearheaded community-based testing for COVID, and that's something that she has also helped to lead with opening up a new site at KIPP Columbus when we did it there. But there's so many people working alongside Autumn, working alongside me, Dr. Joshua Joseph, Dr. Nwando Olaiwola, Dr. Darwin Conwell, who's my direct director and supervisor at The Ohio State, and even goes all the way to the top with our Chancellor, Dr. Howell Pause. I'm extremely grateful to you, Columbus CEO, to you, Cover My Meds, to all the awardees who really set the bar extremely high for folks like me and others in our community, to really push us to continue to move the needle closer toward health equity, and really centering at the margins and making sure that the voice of our most vulnerable, the voice of those who are marginalized, is heard and acted upon. So thank you on behalf of my family as well. Thank you. I'm surprised my kids, my 1-year-old, 3-year-old, and 5-year-old have been quiet this long to allow me to get these words out, but thank you to them as well. And I hope you all have a great evening.
Great, thank you, Dr. Gray. And thank you to your family for their cooperation. And I just want to say there's so many inspiring stories we just listened to. Well, both our winners, our pandemic heroes, and it makes me think that, you know, we have hope, that we can get through this difficult time, that we will see the other side of this because of the contributions of the people here tonight and so many others in our community trying to do what's right and trying to take care of each other. So I just want to thank you for all that you've done as part of the 2020 Columbus CEO Healthcare Achievement Awards and their healthcare heroes. Stuart and Eden, thank you so much for being part of tonight's program. Thank Cover My Meds for its support of what we're doing here. And thank you for tuning in. And I look forward to seeing all of you in person, perhaps, next year. Take care and be well. Thank you.